able to help me with this in the early process. So joining me today is my breastfeeding peer counselor, Talika Howard. She'll be helping me with this presentation. But she is an international board certified lactation consultant. She has 20 years experience helping moms and babies breastfeed. Talika is a mother of 7, which everybody's always super surprised every time we say that. She breastfed them all, and her youngest 2 were twins. So she comes to my team with an immense amount of experience. And she works with us providing education, the clinical lactation support, and infant feeding management to my participants that promotes and supports breastfeeding. Using my app is now called Lact Coach. It has gone through a bunch of different names. Yeah, so I'm going to show you that a little bit about that. So we have no conflicts of interest as it relates to this presentation. This research, though, was funded by the Gordon and Betty Moore Foundation, which is a fellowship for nurse leaders and innovators. So I spent 3 years in their leadership program, and without their funding, I could not have done this work. So I will talk to you to help achieve our learning objectives today. I'm going to talk about the design thinking process with a race-conscious lens, and I'll talk a little bit about the community engagement that I did for this project. And then Talika will wrap us up talking about the mobile health intervention that kind of came out of this and the clinic-based support that we're doing at Rush. In this presentation, I typically use woman, you hear me say that, I use breastfeeding, but that's just to conform to what my research participants in this particular presentation I'm talking about. So it's not intended to be inclusive, and like Joanne talked about this morning, we acknowledge the different gender identities for both pregnant and lactation persons. So I want to start out by talking about designing from the margins. I know this may be a new term to some people, so I thought maybe that was a good place to start when you think about that concept. And designing from the margins, typically when you look at technology-based research or even just technology-based interventions anyway, they're usually centered around the dominant population. That's where they start from ideation, that's how they start, and they kind of forget about those that have the greatest needs. People who have the underserved populations like Paula was talking about earlier, they're pushed to the margins. So as you'll see in this presentation, I'm a visual person, so I thought this would kind of help you understand what I'm talking about when I say designing from the margins. But this type of work, and when we take that approach, this increases the persistent existing racial disparities in health that we already see among African American families. And so when we talk about design from the margins, you need to take those people from the margins. And that's where you start from ideation to implementation. So this approach has not worked. We're often left out of the research. When I started this years ago, I started this actually in 2017. There was very little work with technology and breastfeeding support, and then specifically looking at African American population. So this standard approach centering the needs of white population fails to serve groups who have been marginalized in our society, and it's not what we want to do when we say designing from the margins. So what we need to do is focus on the margins to kind of create that lasting change. And so what I try to do with my research is focus on the people that have been faded into the background and get them from the margins and bring them up to the forefront of the research and the forefront of the designs, especially when we talk about technology design. So for my project, this takes a more equitable approach that centers the needs of groups who have been marginalized. And so we center the needs of African American parents to design a support app. I was really focused on the breastfeeding support and closing that gap from hospital to home. So this moved the individuals, like I said, from the margins to the center. And so when you center the needs of those that are most impacted, we have a stronger system for everyone. So there's nothing that constrains my app because it's designed right now for African Americans, but there's nothing that will constrain it from being scaled up to the larger population. When we take the traditional approach where we're left out and faded into the background, oftentimes designers will try to then, like as an afterthought, say, okay, let's push this and make it be culturally relevant for other populations. But what happens is it's like a retrofit. and it doesn't meet their needs. So this is just flipping the switch, doing things differently, and putting those with the greatest needs at the center of it all. So what I did was use the design thinking process, which is a technology-based process, and has these kind of succinct steps that you take where you understand human needs, you focus on the community to frame the problem, because you want to make sure you're kind of going towards what they really want and what they need. You work with the community to create ideas, or your team that have these innovative ideas, and then at the end you develop a prototype that you can test. So what I did for my previous work was I developed this REACH framework that you see here. So basically what this is just everything you guys already know. It's what we've already done and operating in silos. We provide education through paperwork. We give gobs and gobs of brochures and information. We give them the activity tracking paper to do and when they leave the hospital. So I've taken all of that, and my idea for technology was try to cram it all into one app. So that's why it's been taking so long, and it's been a very, difficult task, but I keep working on it. So that's the framework you'll hear when I say REACH. I'm talking about all the things that we do with the resources, education, activity tracking, give those tailored messages, and then help from peers where they can connect and talk to each other. So the first step for me was this community engagement. And I didn't look at the time when I started. I tend to talk too much, okay? I was like, raise your feet when we get close. So the community engagement. So what I did was I pulled together a research advisory board, and I see some of my people here. So I definitely encourage you guys, if you have an opportunity to do that and participate in research, it is very valuable. And we as researchers love it, need it, and I'll be doing it again with my next project. But I had 5 breastfeeding and lactation experts, and then I had 5 parents. And so I'm new to Chicago. I've only been here about 4 years, but this really helps me to understand the needs of the community, see if it's the same as what it's been when I've been in 2 different other cities. Is it the same? Are they seeing the same issues? So I really had the opportunity to talk to people. They could share their stories, share their experiences. But this helped me to understand things in the Chicago area. And we worked through that design thinking process. I was able to see their world and get a deeper understanding of what women face. And it let me know that it pretty much was something similar to my previous research. So I was kind of on the right track. And then we just kind of developed the REACH framework. So I was able to show some mock-ups, some designs, my idea. I brought the research framework to the community, to the advisory board, because I didn't want to develop something that did not meet people's needs. And so I was able to hear their opinion, share my idea, and get that feedback before I could test it on a larger scale. So from the stories and experience, what I found was 2 things kind of came up. We had about 8 sessions throughout the year, and really a lot of people talked about there's no such thing as anti-racist care for us, meaning us. Everybody on my board was African American, so that they self-identified as that race. So that was talked about a lot. And then there was limited resources, limited support for African American women. So as we talked about those things and we tried to brainstorm ideas, because I'm all about not just talking about the problem, what are we going to do about it? When we know what the problem is, how do we fix it? So we were able to talk about it, and that's when I introduced my idea of the technology-based app and trying to pull all those things together in one app. So what the solution was to address this problem, empower African American women to challenge racism when they experience it. Because we can't change the doctors, the providers, the care that they're receiving. And so we're making some strides, but we're gonna have some instances where you're faced with that. But how do you advocate for yourself? So they thought the app was a great way to do this, and so I took off with that and to see, how can we move beyond just talking about the problem, and so what can we do? So I did end up with a functionally beta app. This is like the beta test of the app. So like I said, it's now called Wax Coach, and I have the 5 components in the app. The advisory board liked the fun appearance, the earth tones. They gave me lots of feedback. But women are able to connect with Talika for professional support. They're able to get the education, the articles. Some of my advisory board helped me write the education. Talika wrote a lot of it. I wrote a lot of it. So we have that education for them from experts. Because in my previous research, a lot of women were pulling up stuff from their cell phones. And I must say, I'm not a tech person, by the way. My son is tickled to death that I've developed an app because he has to with so much stuff. But in my previous research, women kept pulling up their phone, you know, and they were always on their phone. They were like, oh, look at this and oh, look at that. And if you've read it in my research, there's one that I talk about where this mom was giving her baby bottles of water because of the negative framework that she'd heard of formula. So she was terrified to use formula because of the risks of formula that she was talked about, and she thought formula was going to give her baby brain damage. So she was struggling with breastfeeding, and she just decided to kind of temper that brain damage by giving bottles of water. So, and then I was like, why are you doing that? She pulled up her phone and showed me where she got it from this parent group, this blog. So hence, I started, okay, y'all want to be on your phones? So let me get to work on something that's from us, from the providers, that's for us, and that's because you're already marginalized and pushed to the edges, and now you're doing something that's even puts you more at greater risk. So I'll just say that's how it started. So I was grateful for the help from the advisory board to kind of get the key resources so moms will know, you know, what that was, what information was there. So I know I'm running out of time, so let me get to where Talika can come up here and wrap this up. But what we're doing now to bridge the gap from the problem to actually doing something is we're testing it at the Rush clinics. We've recruited 40 participants from Rush clinics to test this out. They're using the app, and we just tell everybody use the REACH framework, use the app to help you self-manage your breastfeeding. So what I'm doing is watching in the background, just waiting to see what they're using, how it's helping them. And then I'm talking to them at the end. We're following them from pregnancy to 3 months. And so at enrollment, we had 85% of them talked about having strong intentions to breastfeed. And then at birth, and then after they had that intention, actually 47%, I think, said that they were going to exclusively breastfeed for 3 months. So at the beginning, that's where we started. So we have seen a little uptick by testing this out at birth in that 1 to 2 week time frame. Like Paula was talking about, 100% of the people participated and said that they were actually breastfeeding. So where we are now with the people that have completed at 6 weeks, 100% were actually breastfeeding, and about 14 or 15 people have completed the study through 3 months, and 93% of them are breastfeeding, with 50% of them giving some formula. So I'm gonna stop right there and kind of turn it over to Talika to kind of wrap this up.
Okay, so in enrollment, that's when I started helping enroll. We started placing flyers for mothers to scan the QR code, but mothers weren't really responding to that. So I found it was better when I went into the clinic and personally passed out flyers at about 28 weeks, and then following up back with them. I found that it also helped them to get to know me, ask preliminary questions, they get a feel for who they're gonna be talking with through the app, and so that helped a lot in getting the women in the program that we needed to get in, okay? On this slide, we have required BPC visits listed for the study. So they saw me at enrollment when they first decided to enroll. They would get a gift bag, and I would just talk about the program, sign necessary forms and things like that. And then the 1 to 2 weeks postpartum before that, we didn't account for mothers wanting me at the hospital. So they would message me through the app and be like, I'm in labor, I'm having my baby, can you come? So me and Armika decided to incorporate that, so I would come up to them in postpartum and help the baby latch and just talk to them about what to expect and things like that, remind them about the app. And it helped too because the lactation consultant on the floor didn't always, wasn't always available to get to them right away, so that helps. During the 1 to 2 week postpartum visit, we would troubleshoot any issues we may have, give them encouragement if they're doing good, because that matters too. So if everything's going well, encouragement goes a long way, like you're doing great, everything is great, because you need to hear that when you're a new mom. And then I would also refer to them for other programs that Rush had if needed, the Family Connect home visits, and the lactation clinic that they have, a new lactation clinic. Oh, thank you. That was perfect. Okay, so bridging the gap, the pros from the BPC side and going through the app, We did virtual visits using Microsoft Teams, phone calls, and answering messages through the BPC page in the app. They really like being able to just message me through there, like, I have a question, what do I do? And then they wouldn't have to just stop and have to make appointments, get up, take the baby somewhere. They can just have access to a lactation consultant. I was also able to help participants advocate for themselves. For an example, a mom, her milk supply dropped suddenly. She didn't know what was going on. I found out the birth control that they put her on was contraindicated for breastfeeding. I looked it up on LacMed. She wasn't supposed to have that birth control at all. So not only was it reducing her supply, but it actually said it was dangerous for baby. So I sent that information to her. She said that when she first told them that, they kind of disregarded her. They were like, well, after, once breastfeeding is established, it's fine. So when she sent over the information I sent her through LacMed, they were like, oh, they changed their opinions.
Right.
Yeah. So she was able to empower herself to do that, to, instead of saying, oh, well, this is, it is what it is. I also worked with her to relactate, and she said her supply gotten better, like in a few weeks after I helped her with that. The cons, we had some technical difficulties with push notifications, so we had to remind moms, hey, we're here, use the app, don't forget the app is here, because a lot of times, especially when they're young, you're kind of driven by those notifications popping up on the phone, or you'll just forget that it's there. So, once we got that working, use of the app improved. Also, issues with using Microsoft Teams through meetings, some issues with their phones on their end about getting the app, having to, change the app, update the app, that's what I'm trying to talk about. So, update the app so that it would help with their phones. And then there's a lot to consider when deciding to use technology in healthcare. Here are a few recommendations to get you started. Be sure to research the development of any technology you're interested in using in your practice or institution. It's important to have a clear understanding of the goals for use, how it was developed and tested. The technology should be easy to use. Consider any needs to train staff and parents to use it, as well as any related costs. Lastly, the security of user data is always important, and system requirements should be verified for HIPAA compliance. So if you're ever thinking about bringing something over to your clinic or institution, this is important to consider. Okay, so next slide. Oh, thank you. Okay, so I was telling her thank you for this. No, but this is really fast, and then I'm done. These are just some quotes from the moms. These are some quotes from the moms. One said, the consultations have saved my breastfeeding journey from cracked nips, doubting, and wanting to give up to exclusively breastfeeding. That was about me. We also do weekly messages. So we send them weekly messages once a week tailored to where they are in their journey. And so I asked them in the Help with Peers page, where we chat with one another, what is your favorite message? And so she said that it's okay to feel what I feel, to give myself grace, and to ask for help when needed. The app is better than using social media because it is more realistic. I like that the information is in bite-sized chunks and has helped me out through my journey. And then on this left-hand side were the initial testers, not the people in the program, but they just kind of tested the app. And I'm just gonna read one more. She said, I really like it. WIC has pacified, but I like this better. This is community of people. We like to talk to people like us. I love that. So, being able to communicate, with Black women was really powerful, and it helped. Okay, now thank you.
That's a great app you're developing for us. Great.
Oh, we're gonna do a question and answer at the end. That's why we're trying to talk for 20 minutes. Again.
I'm happy to do my own, but if somebody wants to.
I'll introduce her. Okay. Thank you. Look, we work together too. Lauren. So next we have Lauren, Dr. Keenan Devlin. She's medical anthropologist, research scientist at North Shore University Health System. Now Endeavor. I was like, look, see, they pull these bios from our pages. So now Endeavor Health. I remember that. Let's see. She specializes in mixed methods biosocial research, investigating the role of psychosocial stress and perinatal health disparities, with a specific interest in postpartum having spearheaded and managed a breastfeeding peer counselor program at Evanston Hospital since 2016. Dr. Keenan Devlin currently serves as the co-investigator and project director of the FEEDS, which is Furthering Equity Through Infant Feeding Education and Support, which is a randomized controlled trial at Endeavor Health and the University of Chicago. So take it away.
Well, thank you for that introduction. I'll try to kind of bring our work together at the end, and I will do my best to keep on time so we can have plenty of time for conversation. So my goal in speaking with you all today is to talk to you about how we're integrating breastfeeding peer counselors into our clinical lactation teams to really close gaps and meet needs for patients. And so just real quickly, how many people here are breastfeeding peer counselors in the room? Oh, lovely. And how many others are direct lactation care providers? So IBCLC, CLC, awesome. Okay, so we got a lot of direct practitioners. How many people support lactation programming? Brilliant, okay, good. So I'm gonna try my best to kind of talk to everyone in the audience today. So this is, you got the gang up here. So I've got Janice Nelson, who's our breastfeeding peer counselor at Evanston Hospital. So our flagship program. And Janice came to us with already 18 years of experience under her belt as both a breastfeeding peer counselor and a doula. She's a mother of 6, so lots of personal experience as well. And she's been at Evanston Hospital for about 2 years, going on 3, right? Yeah, that's right. January will be 3. And then I've got Desiree Mojica, who's our breastfeeding peer counselor at Highland Park Hospital. And she's been with us for 2 years as part of the FEED study, but again came to us with a wealth of experience working at WIC as a breastfeeding peer counselor in Lake County for, was it 18 for you as well, or 20? It was 20. So really experienced, fantastic team. And then I'll also say hi to Yesenia, who's one of our breastfeeding peer counselors for and I know a lot of other faces in this room. I see Julie, I saw Jessica again, so good to be here with all of you. And so, my goal is to just tell you how we've been integrating peer counselors into our clinical care teams. Specifically, I'll also mention a little bit of our design process. It was different, but I think there's some overlap in kind of this community engagement strategy to really meet the needs for where we're at. And then I'll also talk with you about our randomized control trial, which is where Dr. Jefferson and I have had the opportunity to collaborate, and we're going to even deepen that collaboration, so I'll mention that at the end too. So I want to start with why we started and why we started thinking about breastfeeding peer counseling. And I'm an anthropologist. My focus is on healthcare experience. I'm also a mother, and I think we really underserve people in the postpartum period. You kind of fall off a cliff. They send you home from the hospital. It's like, good luck, make your way, find your resources. And I think there needs to be a lot more accountability for health systems to take care of people in that period of time, and particularly around lactation. And so my goal in doing research, I think I'm always stunned at how little evidence drives practice. And so I really am trying to generate the evidence for us to improve our practice and meet the needs for families. And so looking for high impact strategies to address real challenges. And so this data is really what drove us to start breastfeeding peer counseling. So the line at the top is Evanston Hospital from 14 to 15, these are by months. And this is the exclusive breastfeeding at discharge rate at that period. That was before we had a peer counselor program. The average was about 67% exclusively breastfeeding going home. The black line represents our North Shore Community Health Center, which serves publicly insured patients from the Lake County and Northern Cook County area. And you can see we had a tremendous disparity in exclusive breastfeeding, 21% of baseline. And to get these data, I had to open and review 250 medical charts because there wasn't even a way for us at the time to look at the differences in our birthing population. They didn't stratify by race and ethnicity, so we didn't know the disparity until we put in the work to get the data. And so using this data, we were able to get some foundation funding. That foundation funded a collaborative in the Evanston community to brainstorm what the needs were and how to meet them, and breastfeeding peer counseling was where people came together. And then once we got the money, some of the community support kind of fell away, but we said, well, you know what, we still have these resources, we still have the need in this health system. So we held focus groups, interviews, and surveys. I think we ended up with input from maybe, I think it was about 300 families from all of those resources. And We had them in English and Spanish, and the key takeaways from people and what they needed were these. So they said, we need more prenatal, we need more education, it needs to start early. We need an automatic postpartum visit with a lactation specialist. There was no expertise in the clinic when people were coming back for their follow-up care. We need education more around delivery, because at 20 weeks maybe you're not thinking about breastfeeding, but later on you are. And then they wanted language congruence, if at all possible, and then in-person breastfeeding education that lined up with those prenatal visits instead of having to come back on a Saturday for 3 hours. And so we took that into consideration when we developed this model. And I just to give you the overview, the care starts early. Janice meets with patients starting in their early pregnancy. Every patient at the North Shore Community Health Center, even if they aren't intending to breastfeed, gets a consult, because there's still a lot folks can learn, and especially if they're on the fence or open-minded, there's opportunity to talk about breastfeeding. There's assistance with getting breast pumps, having prenatal education sessions, either group or individual, a lot more individual with COVID, but hopefully getting back to group. And then 3rd trimester follow-up, a warm line where people can call in. And then Janice is integrated into the hospital, so she is able to see patients when they deliver. And that took a lot of effort to get our medical record to let her chart in both the context, but she's there. And then also has the opportunity to connect with people, connect people to programs if they're getting their care at an outside organization. And then there's all that follow-up after discharge. So the proactive check-ins, being able to reach somebody at a call, following up at a postpartum appointment. And then Janice has a support group every Thursday in the hospital as well. So the result was really stunning, even for me, although it probably shouldn't be, because we know that care and support work. And so the light colored bars, that if it stops flashing, were the pre. So I'll just give you the synopsis. It was 21% before, it went up to 31% exclusive breastfeeding, which was pretty remarkable, because these were high-risk patients, and as Dr. Meyer was alluding to, there's a lot of breastfeeding barriers. And then breastfeeding at 6 weeks went from 29% to 65% overall. So we saw a huge improvement in postpartum maintenance of breastfeeding. And then it's broken out by a couple of racial and ethnic groups, and you can see the biggest improvement were for our Black and African American and Hispanic Latino families, especially Spanish-speaking families. And so we, the community health center is just a subset. So we said, can we scale this up and make this something that's available beyond just one clinic, but is a hospital level program? And just to kind of call out, what we were hearing from families, they said, the peer counselor made me feel confident. That was really a word that came across. They made me feel like breastfeeding was possible. It's given me hope. It's made me less nervous. So we really saw these themes of feeling prepared and feeling like it was something that they could do. And so now I'm gonna call up my peer counselor team. If you guys probably come to the mic so they can hear you on Zoom too. And I was hoping that the two of you guys can just talk a little bit about why clinically integrated breastfeeding peer counseling works. I think this audience probably knows generally why it works, but maybe you can say a few words each.
Well, just kind of give you a little summary. As I said before, I am a mother of 6, so I've been able to be on both sides. So I was able to be on the mother side, receiving breastfeeding peer counseling support and lactation support, and then on the other side of giving it out. And so my personal experience, I was able to experience what I'm modeling now. So I was fortunate to be able to be connected with a WIC program that was connected to Mound Square Health Center, who had a lactation consultant there. And unfortunately, it didn't have a peer counselor assigned, but that's where my journey started. I was one of the first peer counselors for the WIC program from Mound Square Health Center. So me, along with the lactation consultant and another young lady, we started the breastfeeding peer counselor program for the WIC for Mound Square. And with that, we were responsible for educating the moms who came into the WIC program, also following up with them after they gave birth and came home. The difference between that program and the program that we're doing here at Evanston is that, one, we wasn't able to have access to the moms once they was in the hospital, but once they came home, we were able to follow up and see how breastfeeding was going at home, and to offer them to be able to come back into the WIC program, to the WIC program to actually get help if they needed help. The difference between the WIC program and the program that I'm in now is that because the moms, when they were pregnant, had to come in to get their receipts, it was able to be mapped out on how much education that they were offered. So they wasn't bombarded with a whole bunch of information at once. It was kind of spread out through their 9 months of pregnancy. Whereas with our program, we don't necessarily have that opportunity. I'm able to set up a class and give them the education, but it's kind of giving it a whole breastfeeding course at one time, you know. But with that understanding, I'm informing parents that what I'm giving you now, majority of this you're going to forget. So my job is once the baby is born to make sure that anything that you have forgotten during pregnancy, now we can go over it. So that latch, the positioning, things of that nature, which goes all out the window when you're frustrated and got a crying baby and you're sleep deprived. So now my job is to make sure that the mom has the support and the education that she needs afterwards. So my personal experience, I have turned into my professional experience and want to offer that same service, because me personally, I was able to see how as my first time being a mom, that helped, you know. And sometimes it's not just first time moms. Baby number 4, I've somehow forgot how to latch a baby on. But, you know, but again, sleep deprivation, you know, tired, pain, things of that nature makes things that used to be natural for you a little bit more complicated. So even though I don't only offer education to our first time moms, I offer education and support to any mom who wants that and who needs that support. And so being able to do follow-ups and offer this information to moms afterwards and beginning and before has been able to help increase our program and our numbers.
Oh, I don't need a mic because I'm very, very loud.
So
That's
now,
me.
maybe just stand
Go
next
ahead.
to it.
Oh, there's a Zoom. Where's the camera?
We've got somebody in.
Okay, I'll stand right here because I like walking. Okay, so I'm a peer counselor. I've been peer counselor for 20 years. And how this all started was this was never my plan. This was never in my vision, but I think this was God's plan. One, I've always wondered why I'm all so loud, why I'm always, you know, like this. And now I know why. Well, 23 years ago, I had a child. I was always told I could never have kids. I never had a period from the age 11 to the age 24. Okay, and I know we're going personal with you guys, but I gotta tell you how this all started. I lived life. I started smoking maybe around 18 years old. It was more to be cool, you know. I wanted to be the cool girl, like, yeah, I smoke, yeah, give me a cigarette, right? So I would smoke just to be cool, and then that just became a habit, right? And I couldn't have children, so I just lived my life knowing I couldn't have children. I'm a big fan of roller coasters. I started just riding all the roller coasters. It was just the best thing. The best ride for me was always the giant drop, okay? And the giant drop was just taking me from the top. And I never felt anything through that last year, okay? So my mother tells me concerning, I need you to go to the doctor. It's been so many years. You're 24 years old and you don't have a period. That's not normal. Well, Mom, I was made unique. You know, I am just different. I call my sister, who never, to this day, doesn't like sister bonding. Okay, she's what is it? I'm an extrovert.
She's an introvert.
She's an introvert, and I'm very I embarrassed her, right? So I said, well, can you at least go with me to the doctor? Mommy wants me to go to the doctor. Well, only if you promise me you take me to Kohl's. All right, take you to Kohl's. It is what it is.
Yeah, go shopping. Sure.
We're going into the doctor's office. By this time, I was working in Walgreens in the photography. Go in, still smoking, whatever. Go in. The doctor tells me, no, the nurse. I go to a clinic because I very low budget. I couldn't have enough money, so we go to the clinic, get checked, everything. The lady's like, I need you to go to the pregnancy line. Oh, no, I'm not pregnant. I can't even have kids. And the lady said, oh, well, we need you to get on that line because that's just the process. All right, sis, just get in line. I told you we gotta go. It says, come on, Mommy really wants us to be here. Get in line. Long story short, they give me into another. They do blood work. You're not pregnant. The doctor's gonna see you soon. Another lady comes in and says, you know something? We have to do another work. We need to do urine test for pregnancy. Oh my God, my sister at this point is done. I am so done. And my sister's a potty mouth. I am not. My sister's like, I'm so right? I'm like, it's just part of the process to get checked, right? So now we go in. You're not pregnant. This is what I'm trying to tell you. Just never had a period. This has nothing to do with the pregnancy. I can't have children, right? So now they have me and they put me into this room, you know, as a woman, we're all women, they have your legs open, they're about to go in, right? And I go to my sister, it's a tumor. I just know it's a tumor. I've been feeling lumps back here, but I always hit it. I always hit that lump. And my sister's like, oh my God, it's goosebumps. That's what it is, sis. It's goosebumps. I get it all over my body. I said, oh my God, stop. I've been getting it like in my stomach. She's like, yeah. So now we think it's goosebumps, right? But she's really working me because I have fear now. It's a tumor, it's cancer. So now the doctor comes in, when is your last period? I've never had a period, whatever, this works, they check me, da-da-da. The lady's doing her homework, you know, it's just so uncomfortable, doing her homework. She's like, give me a minute. And I'm like, oh my God, it's cancer. You know, you're just like, it's cancer, it's just cancer. Lady walks away, she comes back, she checks me in, doctor comes in, she's like, have you had any pain back here by your ribs? I was like, no, I haven't had pain. I was like, I feel like somebody's hitting me. I was like, but they're goosebumps, right? Sis, they're goosebumps. I wanted my sister to confirm there were goosebumps, because I didn't want the doctor to tell me, it's cancer, ma'am, you're dying, right? So now things happen, he does what he has to do, and I feel horrible pain, and I just feel something just shift, right? And I am like, right now, I'm a good heavy-sized woman, but back then I was almost 100 pounds less, okay? So you're just like, where's this child at, right? And the doctor goes, ma'am, I need you to go to the hospital. You're 6 centimeters dilated.
What?
And I do this. I was like, what does that mean? I am not joking. I literally said, what does that mean? And my sister hits the table, you're effing pregnant. And I just start crying because I am the auntie who has everybody's children. I am the lady who goes to the park and I push a child. That's all I ever wanted, to have children, right? So I'm like, I just jacked it all up. What's going on? My sister's already like, I can't even believe it. You knew this, you've been hiding this. I'm like, why would I hide this? All I wanted was children. All right, fast forward, okay? Now we're fast forward, I'm having my child, okay? And I'm like, I don't know, we go to the hospital, how does this even happen? I want to go get my nails done, I always wanted a child to see me nice. So I told my sister, they told me there's a health department, you know, I'm trying to talk to my sister. No, the health department had another place for social, but to apply for medical card, right? I was like, I'm just gonna go next door. I'm gonna have to drop you off. This is not gonna work out. I never went to the health department. I went to go do my nails. Dropped her off, went to go do my nails, because I said, if there's a child coming, I want my son to look at me nice. She just has to look at me nice. Not all about makeup, da-da-da, that was my story, whatever, right? So I come home, and there's so many cars in the house. There's so many cars in the house. My sister calls me, where are you at? Are you going to pick me up? Sis, I got my nails done. I said, no, you're going to labor. You're not understanding. There's a child coming. I said, I got to break it to mommy, right? So I come inside. My mom is speaking around the house. I come inside the house. At this point, I don't know where to go. I have nowhere to go. I come inside the house, and I'm talking to my mom. My mom's crying. Her dad just passed away. And I'm like, oh my God, what do I tell her? Like, you know, mom, it's this time. Like, do you want to go to the funeral, or do you want to go with me? Because there's a child coming, right? So I tell my mom. My mom's like, you're lying. You're always full of jokes. No, mom, this is real. This is really real. There's a child. No, I'm done. I'm done with your April Fool jokes every time. Mom, this is real. Like, anybody listen to me? There's a child coming. Anyways, I tell my husband. My husband's like, I'm over this. You're always just joking. Everything's a lie for you. My husband doesn't show up to the labor. Okay? Doesn't show up. I have 24 hours of labor. My mom goes, my sister goes. I don't know where to go from left to right. Lactation comes in. A lady comes in. She's like, are you going to breastfeed? I was like, I don't know. I don't even know how to breastfeed. I don't even know. You know, and I knew what a nipple was, but for some reason, your mind just goes blank. Are you inverted or not inverted? I don't know. I don't even know if I'm inverted. I mean, I was just lost. I didn't know if I had a nipple, no nipple. I really did not know nothing. So anyhow, I have a child. We don't know how to name it. It's back in 2000. We don't even know how to name this child. We have family coming in like, what the heck? Yesterday you were in Grand America and you're a smoker. Your son's going to have lung problems. And I'm a woman of faith. So at that point, I'm like, you're going to just fear God. You're not going to fear the world. And you're going to be a man after God's own heart. That's all I said. I didn't know what to say to this child. I already had jacked it up, right? So the doctor tells me your son has asthma. And I'm like, I knew it. I thought, damn, I wanted to have kids. My son has asthma. And of course, I spoke life into my child. Da-da-da-da happened. So now somebody tells me, well, here, call WIC. They're going to give you formula. And I'm like, well, no, doctor just told me that my breastfeed's gonna help with the asthma. Now I'm all confused. Breast milk formula, what do I do? Okay, go WIC, get out of the hospital, go to WIC. I'm sitting down, and they're like, when was your baby born? I was like, yesterday. Like, I don't know. Okay, when was your last period? I was like, I never had a period. I mean, I sounded so jacked up. You know, I just stopped smoking 2 days ago. It was just, I sounded like I was from the streets. I just sounded so wrong, right? Didn't have that support. We're gonna let you see a lactation. I didn't even know what lactation was. I go into the room. She's very confident, puts on her gloves. She goes, go ahead, take off your shirt and your bra. And I'm like,
That part.
oh my God, I'm just so uncomfortable. This just doesn't work like this. Like,
That part.
and I'm like, really just like, are you sure? Like, you know, I don't think I have a nipple, but it's a little bit in. And I'm like, it was just so overwhelming. She never heard my story, never asked me questions. That to me just felt like, this is just too much. I just had a child. You don't even know my story. And now you just want to see my nipples? I mean, that just doesn't happen, right? And of course, I show her my nipples and she's like, we're celebrating breastfeeding month and we want to know if you could put you on the cover of a paper. And I'm like, sure. I mean, I'm checked out. Take a picture with the pump and I'm like, and I'm smiling and I'm like, this lady doesn't know nothing of me. I didn't walk out with any support on latch. I still have sore nipples. I don't even know why I have a nipple anymore because my son had injured my nipples so bad. Behind my mom's back, I'm offering formula because my mom's Hispanic. In Spanish, you gotta follow what mom says. I'm offering formula behind my mom's back when I'm breastfeeding, and it was just the most horrific pain ever. No kind of support. Maybe 8 days later, I go back to WIC to go get some support. It was recertification kind of stuff. I go back and they're like, are you looking for a job? We need somebody to work here. I was like, oh, yeah. I mean, I don't have a job anymore. Like, what do I gotta do? Pure counselor, lactation. And I like to think as a lady how she offered support. I was like, no, I am not doing that. I am not asking anybody to show me their nipples like that. It's just not gonna work out. So anyhow, I did not take the job. I ended up taking care of my son for almost 2-3 years. Okay, raised my son. My husband did come back 7 months later, realized it's a child. I don't know what the heck went on with them. But anyways, I'm married to my husband, the same daddy, right? So anyhow, as I continued doing this whole breastfeeding thing, I started working at WIC, started getting to know a little bit more, became very passionate for the patients. Like, heck no, I need to know their story. Yeah, tell me a little more about you. So what you're telling me this, oh my God, so who do you live with? Who's helping you? And all of that just started like developing in my life, you know? Understanding like, wait a second, you're having I had sore nipples too. Like, I just started bonding. Well, you don't understand, I have a flat nipple. I have a flat nipple. I mean, it was just getting so much better and better and better. Little did I know that all these years, 20 years later, like I never thought I was gonna work in a hospital. I prayed that, almost 2 years? A year and a half. I was in front of a hospital and I said, Lord, you know, I think I just need something different, but I don't want to leave this job. I'm very passionate about people. Long story short, I'm in front of a hospital. I'm like, Lord, I want to work with babies. There's just no way. I'm not certified. I'm just a peer. Who nobody cares about peers, right? But only my patients who I've helped. Anyhow, couple of days later, 7 days later, a friend calls me, hey, they're hiring the hospital. There's just no way. What am I losing? I meet Lauren, you got the job. No way, get the job. Oh my God, this is mind blowing. I get to literally now help moms. I'm going deeper into this. It's been just literally a ride. I'm gonna be 2 years in November. The support that I give with moms, I mean, is mind blowing. The love, the compassion, the humbling that I have to do to understand, to steer these moms into a better, we're not just pure counselors. We're more than just a friend. We're more than just a support system. We're more than that. We're listening, we're caring. These moms, I mean, I've gotten messages where it's like, Desi, I got a job so-and-so. And I'm like, got a job where? Oh my God, you're right, we're talking about a job. It's no longer even about breastfeeding, but when I start tying in like, how's Jacob doing? Oh my God, Desi, Auntie Desi, baby loves you. He is like going strong, and they're showing me pictures of the fridge, and I'm like, you know, you became successful because you had somebody leaning on you. You became successful because somebody took their time to listen to you. And as nurses, we're going back and forth, you know? And and everybody here who's a lactation consultant, man, your work honestly is to the T. Because it's we the ones kind of like start it up and then say, hey, now we need you. This is part of past our scope of practice. But as a peer counselor, we could do what lactation does. But it's just different when we work and we team up. Today, my son is 24 years old. He became a minister. I 24 years old. My son became a minister of the world. He's also a Christian teacher. He just graduated from Bible college. So let me tell you, words have power.
Yes, they do.
And I also share that with my patients. Words have power. When you look at your child, don't say, oh my God, fat baby. You say, you are going to eat. You are going to prosper. In my job, I prospered my job through my words. I love what I do. I love the people that I work with. This is a privilege for me. This is not a job. This is a privilege that I've been put into. And honestly, every one of us here, we have a job, but our job is really to build relationships.
Yep.
And that's where everything just starts unfolding. So I'm grateful for my team. I'm grateful for all of you guys.
Woo.
All right, well, I think it might be time time for us to open up to questions. I have a few more slides. I'll make sure those get sent out. And stay tuned. We're going to have more information about the feed study to come. We're about halfway through the trial, and I have some info on that I can send out, and an updated website coming soon. But I think, just to mention the part where we're coming together, we'd really love to bring this app and everything that Talika's done to innovate at Rush in partnership with Feeds. We are looking for another Feeds peer counselor for the Swedish hospital. We really need somebody who's bilingual in Spanish, because about 30 to 40% of patients there are monolingual Spanish speaking. So throwing that out there. And now I guess we'll invite any questions for anybody on the panel. Please ask away.
Question. As it relates to the app, is it for Android and Apple? And then how did you get over the iOS? How did you get through the Apple to get it approved and all of that kind of stuff?
It is for Android and Apple. And that was a huge challenge. And my tech developer almost blew a gasket when I was like, I want it to be for both. I don't, because most beta tested apps are either one or the other. And I really needed to see if this was gonna work. And I know, and I'm not providing phones, because I was like, in the real world, in the clinic, people gonna have to use their own phone. They have to use their own data, their Wi-Fi, whatever. So I really needed it to be like it would be for real, and he did it for me. It was a lot of work. It was a lot of back and forth with Apple. And I will tell you, when I launched it, it worked for some phones. Some phones it didn't. So we're learning a lot about that process, and so I'm finding out what model phone do you have? Why is this part not working? Because some people would say they've been sending Talika messages, but we don't see them. And the mom would swear she's sending messages, so send me a screenshot, and then what kind of phone do you have? So he'd had to do a lot of back end. Yeah, I will tell you, I'm having the most problem with Apple phones.
Yep.
I love Apple, but I hate them. I am an Android user, and I am having the most trouble with Apple
It's the
phones.
proprietary part of Apple that makes it hard. And
Yes.
so that's why I asked the question, because I was trying to do something and I've had the same problem.
Yes, but finally, I think he solved a lot of the issues. It seems to be working, okay. It's a little glitchy, as moms will say, with the Apple phones, because it doesn't load as fast. We want it to load as soon as we click it. And so there are some issues with that. So I think with the next test, we're gonna move to a different platform, which is like the platform he hosted. But then I also have issues where I'm having to be HIPAA compliant, because we are these are hospital patients, and I wanna use this in the clinic. And so then we have issues on that side, which is a separate thing. So it's a real balancing act to try to make sure I got around some of that by not letting people put their names, their full names, their birthdays, so they have to make up a username. I don't care what it is, we've got a lot of different baby mom, baby this, we've got ecstasy something else, and so whatever expression you have for yourself, make up, long as it's not your first and your last name. So that has kind of helped get around some of those hurdles on that side.
Would you consider expanding your research to the rich NICU population? And if so, would you be able to have the volume to manage that?
I will, but the NICU uses another app, don't they use the Keratin app?
Yeah, but that's for milk management.
Okay, so yeah, I am looking to expand, because I'm not working with teens and I'm not working with NICUs, so I just got to get it working first, and then we'll do all those little separate things. Because I started this in 2017, so to just let you know how long it takes and how expensive it is. The funding I got from the foundation was $500,000, and a big chunk of that went to the app. And then, having the breastfeeding peer counselor to show economically this model works. I think the only difference between your project and mine is she's in the clinic and you guys are in the hospital.
Mm-hmm.
So she's at the obstetric clinic, it's like her base, for that. So that's where we have a lot in common, and then that we're just making that connection with the app.
I was thinking about, you need a lot of money, because I was just thinking, we just have Tamika and it grows, and you're still looking to do the one-to-one, right?
Yes.
Peer support.
Yeah. Because we're looking at caseloads too, because I ask her all the time, how's it working with 40 people? It's like, is that too many? It's like, you know, so that's part of why this is like a feasibility study, because we're just looking at stuff like that, like how many? Do you have 50? Like when they, you know, after 3 months, they kind of fall off, so can you take a caseload of 50 or, you know, so that's the kind of stuff, and that's the kind of stuff I ask like with the advisory board, like how many people do y'all manage? You know, Lauren and I talk about that, I'm like, how many do they have? So we talk about that all the time, and one thing I can say we found at 6 weeks, they kind of drop off with that contact. But they say they like that she still sends messages and she still checks in, even though they're not calling her as much. But once they get settled and kind of are on their way, and then everybody's like, how long can I have this app? You know, so my 40 people will have access to it for a year, because my tech designer said he'll host it for me for a year. So that helps, and so that shows me that people want it, and even though they're not making as many touch points with her at that time, they are still wanting to have it, so when they need it.
We're probably at time, but I
Because
just
that's
wanna
what
try to,
I said.
I had a slide just about, you know, this is the big hurdle, the sustainability. I'm sorry, I
Yeah,
want to stand in front of you, I'll stand on this corner. And so I'm trying to learn to be an economic expert. So because this is, I mean, we showed effective programming and it wasn't enough for the hospital until I did some math with a research paper. So I don't know if any of you saw this paper from 2017, but they were showing really the cost benefit of improving breastfeeding, and a 5% improvement in breastfeeding rates at a population level was, I did some math to get us to like an individual dyad. So it saves about $900 for an individual dyad for healthcare for a lifetime to just improve breastfeeding by 5%. So I did the calculus with our rate improvement, and you can see that if you're looking at 6-week improvement of 38% from baseline to the program, that's like $3 million of saving in healthcare costs. And so this was the rationale that finally got the program that Janice has now to become permanent. But we were limping by with foundation funding for a long time. But so I think that's the next, you know, forefront for us. And I'm hoping that now with reimbursement in Illinois for CLC, CLS, and IVCLC, we can capture some of those revenue dollars, because the hospital wasn't willing to reimburse with the CHW code. They were like, it's too much work to put that code in and make a billing system. But they already have lactation underway, so I'm hoping once we now plug into these lactation dollars at a state level, we can actually scale up. So that's the goal.
I just want to speak on for them being have access to your out for a year. One of the benefits of that is because in that year you get to capture all the different mouth points that the mom has, whether it's transitioning at 6 months, going from just exclusively breastfeeding to adding solids, to whether it's going from exclusively breastfeeding to now pumping to go back to work. So all of those different things are captured in that first year. So being able to have access to your app and your availability, that is benefit for moms.
So where's our timekeeper?
I have a thought. So my thought is, being that a lot of us work in marginalized communities, right? And we have a lot of individuals who have trauma, and so they can't fathom putting a baby on their breast, right? For whatever their traumas, whatever stigma, whatever, because my mama said, you know how we do, how we talk to one another. So how do you even introduce this app, this program, this is excellent for your baby, and this, we got this to help you, and how do you even introduce that to an individual like that? Because that seems to be our barrier on our side of town, you know. Like, how do you even get them to even conceive the idea? You understand what I'm saying?
Yeah. And that's where Talika comes in. But I think the big thing for us is we try to meet people where they are. And I approached this, and one thing I told her about my research, I was like, when you talk to these moms, I don't care if they do want a formula feed, don't know, or how they're gonna do it. And that was one thing the advisory board told me. Offer it to everybody. You know, not just to people who say, right now, I know I'm gonna breastfeed. Like, I don't know, I haven't thought about that. What's that? So we put flyers up, and people did see it, and I put my face on it. I was like, hey, you know. So that kind of got people like, yeah, I did see your flyer. When Talika started approaching them, they're like, yeah, I saw that. And so they, you know, was like, what is it about? And that piqued their interest. And you can talk a little bit about how you educate, because we just really meet them where they are.
Yeah, just during enrollment, it is really, the purpose wasn't for me to just go in and convince, but just like, are you on the fence? Are you considering it? You know, this app can help you make up your mind, as well as if you definitely know you're gonna breastfeed. and then they would take that time to ask me questions usually. So, that's kind of how they would decide. So it kind of did double duty because they would be deciding whether to join the program at the same time as deciding if breastfeeding is for them. So me coming from, you know, my experience and all of that, I would be just talking to them about, you know, how every breastfeeding journey is different. You can tailor it for yourself, and getting that breast milk into the baby is really important. And so that was a big touch point for them as far as like enrolling and being able to see the articles and just kind of making up their mind.
And I think just not having that pressure, because that's one of the things I asked them at the end. Why did you join this? Like, what made you want to be a part of this? Because I want to see like how, why, and how. Because some people are not big app users. I've got some people that we consider high users that's using it a lot. Some people that are using it just a little, but they like having it if they need it. So they're like, just don't think just because I'm not using it doesn't mean I'm not, like, I'm watching. I see them little messages she's saying, you know, but they was like, I don't always engage, or I don't always talk to the peer chat, because there's a peer chat, they talk to each other. Some people say they read it, but they don't always post, but I'm reading it. So they're engaged in their own way, and I think just letting people do how they're gonna do with it has helped a lot. So when they tell me they're gonna combo feed, and you know, we're baby friendly, so we had a lot of issues with like me talking about formula in my app or whatever, and I'm a firm believer that we can't just do this one-sided. So I'm talking to you because I don't care if you breastfeed once a day. You are breastfeeding. I'm happy with that. Some is better than none. It gets people then like, okay, they're like, okay, I'll do this, and then that one day turns into 2 to 3 to 4 times, and they continue to breastfeed. So that, I think, is the feedback I'm getting from moms that has kept them. And I have them do like a little anonymous survey, and one of the things on there is talk about, do they feel pressured, and they said that's what has helped them stay engaged, is they don't feel pressured to do this.